So you're having a breast augmentation and you're thin and concerned that the edges of the implant are going to be too visible. There's two things that you can talk to your surgeon about in order to hide the edges of the implant better. So thing number one is to use your own fat. It really doesn't take a lot of fat grafting, to hide edges of the implant. You can often successfully do this with as little as 10 to 20 cc's of fat on each side. So this is a great thing to add in addition to your augmentation to better hide that implant. The second option is to use a fat substitute like Alaclay or Renuva. And this is often a more expensive option, believe it or not, and you can use small amounts of those products to hide the edge of the implant. Now, there's some things you can discuss with your surgeon to try to minimize the chance of having that step off that don't require extras like fat grafting. So the first thing is pick a modestly sized implant that's a lower profile. You'll have less of a step off and less of something to hide. The next thing to consider is the type of implant. So talk to your surgeon about having an implant that does not have as much roundness in the upper pole, that drops into a more natural shape, and sometimes that can help. Although the implants that do that are softer and sometimes there's rippling issues. So, unfortunately with plastic surgery, you tend to give and take a little bit and there's no perfect solution. And then finally, the other option is if you truly have very little tissue and you're worried about implant visibility, going under the muscle can be an option. Although then if you have very little tissue covering the muscle movement can be more obvious. So sometimes you just have to talk about the pros and cons of different decisions and figure out what's the best for you.